In this video, we are going to discuss about the Norma Basalis. That is the view of the inferior aspect of the skull region after removal of the mandible. So after detachment of the mandible, the inferior surface of the base of the skull may be studied in three parts. One anterior part, intermediate part and a posterior part. The anterior part extends up to the posterior limit of the hard palate. That is, this is the hard palate, this area is the hard palate and this is the posterior limit. So till this line it is the anterior part. Then if you draw a line across the anterior margin of the foramen magnum, which is this is the foramen magnum, and if you draw a line through the anterior margin, in between these two lines will be the intermediate part, and posterior to that you have the posterior part of the Norma Basalis. We will see one by one. So first the anterior part. It comprises of the bony palate which is lying over here and the alveolar arch where the tooth is located. If you look at the bony palate, it lies within the alveolar arch. You can very well see that this is the bony palate, it lies within the alveolar arch and is slightly arched from before backwards and from side to side. The bony palate is formed by the assembly of the palatine process of the maxillae, which is shown over here, not this dark area, this is the anterior area, this is the palatine process of maxillae and horizontal parts of the palatine bones. This area will be the horizontal parts of the palatine bones and they are separated by a suture that is shape of a crux, that is known as the cruciform suture. 3/4 of the bony palate is contributed by the maxillae anteriorly and the posterior 1/4 is contributed by the palatine bones. Posteriorly, it ends in a crescentic free margin which is over here. This is the crescentic free margin which presents a midline backward projection, and that is over here. This is the projection that is known as the posterior nasal spine, this area. The posterior nasal spine gives attachment to musculus uvulae on each side. The marking of palatine crest, which is shown over here, is observed close to the free margin, and the free margin extending up to the palatine crest provides the insertion to tensor veli palatini muscle in the form of palatine aponeurosis. The greater palatine foramen, that is over here, this foramen over here, that is the greater palatine foramen, this one. It is situated close to the lateral border of the hard palate, medial to the third molar tooth. This is the third molar tooth and this foramen is located medial to it. It transmits greater palatine vessels and nerves. From the foramen, a groove runs forward. And the next foramen over here is the posterior or lesser palatine foramina, and usually there are two on each side. They lie just behind the greater palatine foramen, which is located over here. And they affect the pyramidal process of palatine bone, which is wedged between the lower ends of medial and lateral tergoid plates. These are the tergoid plates, medial and lateral of the sphenoid bone. And the lesser palatine foramina convey corresponding vessels and nerves. Anteriorly, we have a conical depression over here, and that is known as the incisive fossa, and it involves the intermaxillary suture behind the central incisor teeth. This is the intermaxillary suture and it extends between the two incisors. The lateral wall of the fossa, that is through this fossa you have to look at the lateral side, and this is the right lateral side, and over here this direction will be the left lateral side. On the lateral wall of the fossa, each fossa presents on each side lateral incisive foramen which communicates with the floor of the nasal cavity, and each foramen transmits long nasopalatine nerve from above and terminal branches of greater palatine vessels from below. Sometimes anterior and posterior incisive foramina affect respectively the anterior and posterior walls of the incisive fossa. And when they are present, the anterior foramen transmits left long nasopalatine nerve and the posterior foramen transmits right long nasopalatine nerve. On occasions, a sutural line is found to extend bilaterally in the young skulls from the incisive fossa to the junction between lateral incisor and canine teeth. That is over here. From the incisive fossa to the, this is the canine bone, this is the lateral incisor. So in between them, you can draw a line over here. Similarly, you can draw another line over there. So you will get a bone area of the maxilla in between them, and the portion of the bone that is lying in front of the suture, in front of the line, that is known as premaxilla, which is ossified from separate centers and developed from a separate source. That was about the bony palate. Now we look at the alveolar arch that is present over the side where the tooth was attached. It is a horseshoe shaped and provides sockets for the teeth of upper jaw. Posterior to the third molar, that is over here, buccal and lingual surface of the arch are continuous, obvious, and above that continuity the maxilla presents a tuberosity over here. That tuberosity is known as maxillary tuberosity. On this side it is broken, so this is the maxillary tuberosity. Now let us move on to the intermediate part, that was the part lying between this line over the posterior border of the hard palate and anterior margin of the foramen magnum. In between them there is the intermediate area. So we can divide this structure for better understanding. We can divide them into a median part and a paramedian part. Look at the tip of my probe. So this is the median part in the center and you have the paramedian part on each side. First we will look at the median part. So from before backwards, this median part includes the vomer over here. Actually in this specimen, in this skull, the vomer has been destroyed. So just imagine a midline bone over here, that is the vomer. Then it will have a posterior border. So the vomer, posterior border of the vomer, and it separates two nasal apertures or choanae from each other. Then comes the inferior surface of the body of the sphenoid bone, that is over here, and basilar part of the occipital bone, which is over here. This is the basilar part of the occipital bone. And this basilar part becomes broader as it slopes downward and backward to reach the foramen magnum. Now some details about the vomer. Actually it is not seen in this skull. The upper border of the vomer diverges into two alae as it reaches the body of the sphenoid bone. So in this skull, here is the body of the sphenoid bone and the vomer will reach up to there. The grooved margin of the vomer articulates with the sphenoidal rostrum, which is a structure which can clearly seen over here. This is the sphenoidal rostrum. And each ala of the vomer meets and overlaps the vaginal process of the medial pterygoid plate in the interval between the body of the sphenoid and the vaginal process. So in this skull, this plate of bone over here is the medial pterygoid plate, and laterally you have the lateral pterygoid plate. Over here, this is the medial pterygoid plate, and laterally this is the lateral pterygoid plate. So the vomer comes superiorly and articulates with the pterygoid plate, medial pterygoid plate. So first, a Vomero vaginal canal forms between the body of the sphenoid and the vaginal process, and it runs forward without containing important structures, the Vomero vaginal canal. The inferior surface of the vaginal process presents in the anterior part another groove which is converted into a palatino-vaginal canal when it articulates with the sphenoidal process of palatine bone. The palatino-vaginal canal transmit pharyngeal vessels and nerve. That is not obviously seen from this skull. Now we will move on to see the other structures. That is the first one, medial and lateral pterygoid plates. You can see the medial pterygoid plate over here and lateral pterygoid plate over the lateral aspect. Over here is the lateral pterygoid plate. Medially you have the medial pterygoid plate. It extends downward behind the third molar tooth and lateral to the choanae. This is the third molar tooth. This was the choanae. Actually choanae will be separated by the vomer which is absent in this skull. The infratemporal surface of the greater wing of the sphenoid, that is over here. This was the pterygoid plates and this surface over here is the infratemporal surface of the greater wing of sphenoid. It spreads horizontally lateralward from the root of the lateral pterygoid plate. This is the lateral pterygoid plate, root of the lateral pterygoid, and it extends horizontally. Next is the squamous, that is over here. This is the squamous part, and tympanic part, which is over here. This is the tympanic part, and Petrus part of the temporal bone. All these parts will come in the Norma Basalis over the intermediate area. Let's look into some more details. First, the medial pterygoid plate. I will show it over here. This plate, that is the medial pterygoid plate. Let's look into some more details. The posterior border of the medial plate is free and traced above, that is we are looking from the inferior aspect, so tracing above means over here. It forms the scaphoid fossa for the principal attachment of tensor veli palatini muscle, and further above over here it leads to a tubercle which overlaps the posterior opening of the pterygoid canal in the anterior wall of the foramen lesserum. So this foramen is the foramen lesserum and the medial pterygoid plate is related to it. Traced below, if you trace the medial pterygoid plate below, it will reach a tubercle which, traced below the posterior border of the medial pterygoid plate, it projects downward and laterally as a hook-like projection which is clearly visible over here, and this hook is known as the hamulus. And around this hamulus, the tendon of tensor veli palatini turns medially to enter into the soft palate. So obviously the palatine muscle will come from here and it will wind around the hook hamulus and then they will enter into the soft palate. The middle of the posterior border presents a triangular projection which is over here, and that is known as the processus tuberous, which supports the medial end of the cartilaginous part of auditory tube. Rest of the border below the processus tuberous gives attachment to the pharyngobasilar fascia and superior constrictor muscle. Pterygoid hamulus is connected to the mandible behind the third molar tooth by the very important structure, that is pterygomandibular raphe. Next is the lateral pterygoid plate. So in this skull, this region will be the lateral pterygoid plate. This plate is the lateral pterygoid plate. It gives origin to the medial pterygoid muscle from the medial surface of the lateral pterygoid plate over here. Its lateral surface over here, it forms the medial wall of the infratemporal fossa, which is the space over here, and gives origin to the lower head of the lateral pterygoid muscle. The posterior border of the lateral plate is free. In the middle, it presents a bony process which is connected to the spine of the sphenoid by a ligament that is known as pterygospinous ligament. Next part that we are going to see over here is the infratemporal surface of the greater wing of the sphenoid bone. It is visible from this view over here. It forms the roof of the infratemporal fossa. It is roughly pentagonal. The anterior margin forms the posterolateral boundary of the inferior orbital fissure. The inferior orbital fissure is over here. You can obviously see the probe. So this is the inferior orbital fissure. So it forms the posterolateral boundary of the inferior orbital fissure. And anterolaterally, it is limited, this surface limited by this crust over here, and that is known as the infratemporal crust. Laterally, it articulates with the squamous temporal bone over here, and medially it is continuous with the root of the lateral pterygoid plate, clearly seen. Its posteromedial border articulates with the Petrus temporal, which is over here, and a sulcus tube is formed between them. So this region is the sulcus tube, and this sulcus tube lodges the cartilaginous part of the auditory tube. This surface gives origin to upper head of lateral pterygoid muscle from here, and it presents a foramen, that is the foramen ovale, which is the probe passing through which the probe passing through. Also, you have the foramen spinosum over here. Just in relation with the foramen ovale, you have the foramen spinosum over here. Lastly, you have the projection from the sphenoid bone, that is the spine of the sphenoid bone in just posterior to the foramen spinosum. The foramen ovale, that is this foramen over here, is an obliquely placed oval slit situated close to the upper end of posterior margin of the lateral pterygoid plate. You can very well see the lateral pterygoid plate over here. So it is close to the lateral pterygoid plate. This foramen transmits two roots of the mandibular nerve, motor and sensory, then accessory meningeal artery, occasionally lesser petrosal nerve, and an emissary vein communicating cavernous sinus with the pterygoid venous plexus and anterior division of middle meningeal sinus. Next foramen I will show over here for better visibility. Our side, this is the foramen ovale, and this will be the foramen spinosum. This foramen spinosum lies posterolateral to the foramen ovale. You can clearly see the relation. It transmits middle meningeal artery, nervus spinosus from the trunk of mandibular nerve, and sometimes the posterior division of the middle meningeal sinus. And posterolateral to the foramen spinosum, we have seen this part of the bone or sphenoid, that is the spine of the sphenoid bone. It is actually a projection from the greater wing of the sphenoid bone, and this spine provides attachment to two muscles, that is the posterior fibers of tensor veli palatini and tensor tympani, and three ligaments, and they are sphenomandibular, pterygospinous, and anterior ligament of the malleus. This spine is related laterally to the auriculotemporal nerve, lateral relation, medially to the cauda tympani nerve and the auditory tube, when the auditory tube lodges in the sulcus tube. And traced posterolaterally over here, the sulcus tube leads into a bony canal for the tube within the temporal bone at the petrosquamous junction. That is, this is the sulcus tube, and if you trace it over here, that will be leading into a bony canal. The zygomatic process of the squamous temporal bone, that is over here, it presents a tubercle, this region, where it separates into anterior, this one, and posterior roots over here, enclosing between them the anterior part of the mandibular fossa. The anterior root, which is present over here, forms the articular tubercle. The mandibular fossa, the next one, that is this region over here. This is entire region is the mandibular fossa. It presents an anterior articular part formed by the squamous temporal bone and a posterior non-articular part formed by the anterior surface of the tympanic plate of the temporal bone. The articular part, including articular tubercle, receives the head of the mandible separated by an articular disc and enters in the formation of temporomandibular joint. The non-articular part of the fossa, that is over here, it is separated from the joint by a portion of parotid gland. If you look carefully, you can see a fissure is extending between the articular and non-articular parts of the fossa. Actually, a part of that is a downward edge of the tegmen tympani of the Petrus temporal bone encroaches on the medial part of the fissure, that is around here, and divides the fissure into a petrosquamous fissure in the front and a petrotympanic fissure behind. The petrotympanic pressure which is present behind, it transmits at its medial end the coda tympanic nerve, anterior tympanic branch of maxillary artery and anterior ligament of malleus. That is about the petrotympanic fissure. Now the lateral border of the tympanic plate, actually this is the tympanic plate, and if you look over the side, this is the lateral border of the tympanic plate. It forms the antero-inferior margin of the outer opening of this meatus, that is the external auditory meatus. The lower border of the tympanic plate over here, it is sharp and incorporated with the inferior surface of the Petrus temporal bone. Petrus temporal bone is located in this region over the inferior aspect. This is the location of Petrus temporal. So the temporal bone incorporates with the Petrus temporal bone, and here it splits, this temporal bone splits to enclose the root of the styloid process, or this region styloid process is broken, so we will be focusing over here. This is the styloid process, this was the tympanic plate. So this tympanic plate is over here, it splits to enclose the root of styloid process and acts as a sheath of the styloid process. Next region is the inferior surface of the Petrus temporal bone. This inferior surface which is present over here, this much region is the inferior surface of the Petrus temporal bone. It intervenes between the greater wing of the sphenoid, which is located over here, and the basilar part of the occipital bone, which is over here. The apex of the Petrus temporal bone, that is, if you trace here, here is the apex of the Petrus temporal bone. It is separated from the body of the sphenoid, which is over here, by a bony canal with the irregular margin, that is known as this foramen, and that is known as the foramen lacerum. The foramen is bounded in front by the body and the adjoining greater wing of the sphenoid bone. We can clearly see that here is the foramen, in the front you have body and greater wing of the sphenoid bone. Behind it is bounded by the apex of the Petrus temporal that we have seen till now, and medially by the this part of the bone, that is basilar part of the occipital bone. And now the anterior wall of the foramen lacerum, that is over here in this direction, this is the anterior wall. It presents posterior opening of the Turgoid canal for the passage of Turgoid vessels and nerves. Next is the posterior wall over here. It presents an opening, that is the anterior opening of the Carotid Canal, which transmits internal carotid arteries surrounded by a plexus of sympathetic nerves and veins. And upper opening of the foramen, that is over the other surface. It conveys internal carotid artery into the middle cranial fossa. The lower opening is closed in the living body by a plate of cartilage. No important structures pass through the lower opening except the meningeal branches of ascending pharyngeal artery and emissary veins communicating with the cavernous sinus. Next, you can identify a quadrilateral area over here behind the apex of the Petrus part of the temporal bone, and that gives origin to the muscle that is levator veli palatini, and the lateral margin of this area, that is lateral margin is over here, and that forms a part of the sulcus tube. The opening that is present over here, that is probed over here, that is the lower opening of the carotid canal, which lies behind the quadrilateral area that you were mentioning just before, and it transmits internal carotid artery. The carotid canal at first passes upward within the Petrus temporal bone, forming the anterior wall of the tympanic cavity, and then turns forward and medially until it appears in the posterior wall of the foramen lacerum. Next, we will look at the posterior part of the Norma Basalis, that is the region that is present behind the line passing through the anterior margin of the Foramen Magnum. This much part is the posterior part, and it presents in the median region the Foramen Magnum, which is this largest foramen of the occipital bone, with a squamous part behind over here, the condylar part on each side over both sides. Further laterally, the posterior part comprises on each side the mastoid process and the styloid process, and a portion of the inferior surface of the Petrus temporal bone over this much region. First, the foramen magnum. It is oval in outlines, clearly visible, wider behind than in the front, and it communicates with the posterior cranial fossa with the vertebral canal, and it measures 3.5 cm antero-posteriorly and 3 cm transversely. That's why it is transverse. Sorry, it is oval in shape. And this foramen is located midway between and on a level with the mastoid process. On each side of the foramen, a tubercle of the occipital condyle over here projects slightly medially and gives attachment to the alar ligament of the dens. The foramen magnum, that is this foramen, is divided by the alar ligaments into anterior small and posterior large compartments. That is, the dens is coming will be over this region over here, and the anterior portion of the foramen magnum in front of the dens, that is the anterior small part, and posterior part will be the posterior large part. Structures passing through the anterior compartment are from before backward, that is apical ligament and occasionally tip of the dens, upper band of cruciate ligament and membrana tectoria. These structures extend to upper surface of the basi occiput. Therefore, anterior compartment of the foramen may be called the osteoligamentous compartment. Then the structures passing through the posterior compartment are the following, that is the lower end of medulla oblongata and the meninges, fourth part of vertebral arteries surrounded by sympathetic plexus of nerves, spinal roots of accessory nerves, anterior and posterior spinal arteries, and occasionally tonsil of the cerebellum projecting on each side of the brainstem. Therefore, the posterior compartment may be called the neurovascular compartment. The anterior and posterior margins of the foramen magnum give attachment respectively to anterior and posterior atlanto-occipital membranes. That is, over here the attachment will be the posterior atlanto-occipital membrane, and over the front that is the anterior atlanto-occipital membrane. The middle point of the anterior margin of the foramen magnum is known as basion. Next is the squamous part of the occipital bone. So it presents in the middle line over here an external occipital crest which extends from the foramen magnum over here to the external occipital protuberance which is present over this region. The crest and protuberance gives attachment to the upper end of the ligamentum nuchae. The arched superior nuchal lines, that is these lines over here, they extend bilaterally from the external occipital protuberance from the middle of the external occipital crest, that is over here. The inferior nuchal lines, which is over, we can trace it over here, they extend bilaterally parallel to the superior nuchal lines. The area of occipital bone between the superior and inferior nuchal lines gives attachment on each side to semispinalis capitis medially and obliquus capitis superior laterally. The area between the inferior nuchal line over here and the posterior margin of the foramen magnum receives attachment of rectus capitis posterior minor medially and rectus capitis posterior major laterally. Next is the condylar part of the occipital bone, that is this area. This area is the condylar part of the occipital bone. It consists of pairs of occipital condyles and jugular processes. Each occipital condyle is somewhat oval in outline, and you can see the oval shape over here, and it overlaps the anterior part of the lateral margin of foramen magnum. We can clearly see that this is the foramen magnum, and this condyle overlaps the anterior part of the lateral margin. The occipital condyle is set obliquely so that the anterior end is nearer to the median plane. The articular surface, which is present over here, it is convex and articulates with the upper surface of the first cervical vertebra, that is the atlas. It articulates with the lateral mass of the atlas vertebra. The junction between the basilar and condylar parts is represented by a line across the anterior 1/3 and posterior 2/3 of the condyle over here. You can see a clear line over here also. Above the anterior part of the condyle, the hypoglossal canal, which can be visible in a slightly lateral position here. This is the hypoglossal canal, and over this side, this foramen is this canal is the hypoglossal canal, and this hypoglossal canal extends forward and laterally over this direction and transmits the hypoglossal nerve, meningeal branch of ascending pharyngeal artery, and occasionally an emissary vein. Sometimes a spicule of the bone divides the hypoglossal canal into two parts. A condylar fossa is present behind each condyle over this region over here. This is the condylar fossa over here. This is the condylar fossa. And its purpose is for the accommodation of posterior margin of the lateral mass of the atlas vertebra during backward nodding of the head. Sometimes posterior condylar foramen affects the bottom of the condylar fossa, which is clearly shown, which we clearly seen in this skull. It transmits an emissary vein connecting sigmoid sinus with the suboccipital venous plexus and occasionally a meningeal branch of occipital artery. The next important structure present over the Norma Basalis, next important area, that is the jugular foramen, which we can clearly see over here. This is the probed space of the jugular foramen. It is a large irregular opening, the long axis being directed forward and medially. The foramen is bounded in front by the jugular fossa of the Petrus temporal bone. This is the Petrus temporal bone that we know of. So here is the jugular foramen. In front you have the Petrus temporal bone, and behind it is bounded by the jugular notch of this bone, that is the occipital bone. The jugular foramen is subdivided into anterior, intermediate, and posterior parts. The anterior part transmits inferior petrosal sinus, the first tributary of the internal jugular vein. Then the intermediate part gives passage to glossopharyngeal, vagus and accessory nerves with the meningeal branch of ascending pharyngeal artery and occasional emissary veins. The posterior part conveys internal jugular vein as a continuation of sigmoid sinus. The commencement of internal jugular vein presents a dilatation, that is a superior bulb which lodges in the jugular fossa of the Petrus temporal, that is over here. The jugular fossa is related above with the floor of the tympanic cavity, and lateral wall of the fossa over this direction, it presents one or more mastoid canaliculi for the auricular branch of the vagus nerve, and just in front of the fossa lies the lower opening of carotid canal separated by a bony ridge, that is over here. This is the bony ridge separating between the jugular fossa and carotid canal, and this bony ridge over here, it presents the tympanic canaliculus for the passage of tympanic branch of the glossopharyngeal nerve. And in front of the jugular fossa, that is over here, and medial to the carotid canal opening, there lies a triangular depression for the lodgement of inferior ganglion of the glossopharyngeal nerve. And from the apex of the depression, a cochlear canaliculus extends upward and transmits aqueduct of cochlea, which communicates the perilymph with the cerebrospinal fluid of the subarachnoid space. And lateral to the, we will continue over this side. This is the jugular fossa. So lateral to the jugular fossa, the styloid process of the temporal bone, it is over here. You can appreciate the length of the styloid process in this view. This is the styloid process of the temporal bone. This one. This styloid process of the temporal bone emerges from the sheath and projects downward and forward for a variable distance. Posterolateral to the styloid process over here, the mastoid process presents a conical projection with a notch on its medial surface, that is over here, for the attachment of posterior belly of the digastric muscle. And medial to the digastric notch, there is another notch or a groove runs backward and upward for the lodgement of the important artery of the external carotid artery branch, that is the occipital artery. Lastly, the stylomastoid foramen, which is present in the probed space over here, this area. Over this side, it is present over here. This is the stylomastoid foramen. It appears midway between the styloid and the mastoid process. It transmits the facial nerve and stylomastoid artery. So that was in general about the Norma Basalis. Thank you for your patient listening.